University School of Medicine. Dr. Al-Aly, thanks for being with us.
Well, Chairman Sanders and Ranking Member Dr. Cassidy and members of the Health Committee, thank you for the opportunity to testify today. I'm a physician scientist at Washington University in St. Louis. My team and I produced the first systematic characterization of LongCovid, and so far the most widely cited research on LongCovid. We've been at the forefront of LongCovid research since the early days of the pandemic, when patients started telling us that they're not fully recovering from COVID-19. Now, LongCovid represents the constellation of long-term health effects of COVID-19. It is a multi-system disorder that can affect nearly every organ system. It affects the brain, it affects the heart, it affects the endocrine system, it affects the immune system, it affects the GI system. LongCovid affects at least 20 million Americans. It affects people across the lifespan. We have kids with LongCovid. We have people who are 100 years old with LongCovid. It affects people across the lifespan and across demographic groups. The burden of LongCovid, the burden of disease and disability from LongCovid, when you measure it, is on par with the burden of cancer and heart disease. And even if people emerge unscathed after having the first infection, they can still get LongCovid after reinfection. And I don't think enough people really know this fact or know about this. Recovery rates of LongCovid are also low. Between low rates of recovery from LongCovid and the cases that are due to reinfection, we are supposed to see continued rise in the burden of LongCovid until we find better ways to prevent it and treat it. Now, you should be asking me now, how do we prevent LongCovid? Well, the best way to prevent LongCovid is to prevent COVID in the first place. There is actually no LongCovid without COVID. You know, if you go back to 2019, you go back to 2018, none of us have heard of LongCovid. Have you? You haven't. It didn't exist. There is no LongCovid without COVID. We need a sustainable, multi-pronged approach to prevent repeated infections that would be embraced by the public. This requires accelerating the development of oral intranasal vaccines that block infections. This is very, very, very important. Ventilation and air filtration systems are also very important. They can play a major role in reducing the risk of transmission of airborne pathogens. We also need variant-proof vaccines. What the virus is doing is really continuing to mutate on us. You know, every few months, you're going to see a new variant. We need a variant-proof vaccine that lasts for a long time, that is durable, that offers durable immunity. People are sick and tired of having to have boosters every few months. We need vaccines that last for 5 years or so they can get it done and get it over with for 5 years. We must also understand vaccine side effects. This must be acknowledged and understood very, very deeply. This is very, very important. Now, you should be asking me also, like, how do we treat LongCovid? You've heard it before. There are zero approved medication for the treatment of LongCovid. So these people have nothing to really lean on for curative treatment, nothing, zero. Zero FDA-approved medications for the treatment of LongCovid. This must change. We really need to change this. It's not beyond the might and the prowess of American medicine to solve this problem. It's absolutely not. We've solved much, much harder problems in the past. We just need to focus on this and solve it. We are the best nation on earth, and we can solve this. It's absolutely not beyond our prowess to address this. Now, people suffering from LongCovid need treatment yesterday. You know, the ongoing and planned trials for LongCovid are too slow and too small to offer definitive treatments. We've developed vaccines at rapid speed, at warp speed. You know what we're doing for LongCovid? We're doing trials for LongCovid at snail speed. This is what we're doing. We urgently need trials, large-scale trials, to test a broad array of repurposed drugs and development of new drugs to treat LongCovid. We must also identify and address the barriers that are preventing the pharmaceutical industry from entering the trials, from doing trials on LongCovid. You could be asking me now, like, is COVID unique in its ability to produce chronic illness in LongCovid? The answer is people reported debilitating fatigue, cognitive decline, and Parkinson's disease after the Spanish flu, but we just swept it under the rug. The other viruses, including polio and Epstein-Barr virus, can also produce chronic disease. EBV can cause multiple sclerosis. Chronic fatigue syndrome, or ME/CFS, is also linked to a viral illness, a flu-like illness. It's a debilitating disease that affects 4.3 million people in the US. These patients have been marginalized and ignored for decades. So what do we learn from all of this? What we learn from all of this is that acute infections, what I learned, the lesson number one from this whole pandemic, that acute infections can lead to chronic disease, that pandemics disable people. And this is not new. It happened after the Spanish flu, but we just ignored it. We just swept it under the rug. We call all of this broadly infection-associated chronic illnesses. This include LongCovid, and includes MECFS, and other basket of conditions that are, emanate from acute infections. And had we connected the dots between acute infections and chronic disease before the pandemic, we'd have been much, much better placed to actually address the challenge of long COVID. We failed to connect those dots before the pandemic. Let's not do that same mistake again and be poised and ready to really, address the challenge of long COVID and also the next pandemic. So where do we go from here? The research effort of long COVID must match the urgency and the scale of the problem. This is my opinion, is really a must. And this is going to require a coordinated approach. In my opinion, the US should consider the establishment within NIH of an institute to address infection-associated chronic illnesses. That includes long COVID and MECFS that have been ignored for a long time, and other infection-associated chronic illnesses. You have an historic opportunity to act. The lives of millions of people here and around the globe, now and in the future, depend on this. Thank you.
Thank you. Our third witness is Dr. Sharice Madlock-Brown, Associate Professor of Health.